On this episode, we'll talk about Jehovah's Witness and the surgeon respecting religious preferences. We'll also talk about, can you get a gastric sleeve if you have epilepsy? And we'll also talk about having a body contouring procedure or cavitation after weight loss surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 227 of the AskDrA show. Thanks so much for joining us and really good questions on this week's episode. If you want to send me your questions, you're more than welcome to do so. Don't forget, just use the hashtag AskDrA throughout social media. We'll add them to the list. I'll be more than happy to be here to answer them for you. Hey, don't forget to subscribe to our channel. It is very important because that way you don't miss out on any of our future episodes because boy do we upload contents. All right, so with that being said, let's get into the show. So our first question, it has to do with religious beliefs. Jehovah's Witnesses have specific beliefs regarding blood transfusions which can make it challenging to perform certain types of surgeries. However, Jehovah's Witnesses are not prohibited of having surgery, and many procedures can be performed, of course, without the need of blood transfusions. Now, the American College of Surgeons, the ACS, the Committee on Ethics have developed a statement or recommendations for surgeons caring for patients who are Jehovah's Witnesses. Now, the statement emphasizes that the surgeon should aim, and that's what we do, to respect and accommodate each of the patient's values and target the best outcome possible for the patient's desires and the clinical condition, which is exactly what we do. I respect completely what the patient's beliefs are, and we work around with that. We work with that. Normally, gastric sleeve surgery does not need any blood component or blood transfusion, and we work with this principle in mind. There are also bloodless surgery options available for Jehovah's Witnesses who believe that the Bible prohibits the ingestion of blood. These options include blood salvage, intraoperative autologous hemodilutions, which can be used to reduce the need for blood transfusions, fractions of blood products like cryoprecipitate, albumin, clotting factors, hemostatic agents like thrombin. And these can also be used in some cases because the decision to accept these products is left to the discretion of each individual. It is important to note that each patient's situation is unique. The decision to undergo surgery should be made in consultation with a qualified healthcare professional. Second question is, can I get surgery if I suffer from epilepsy? Weight loss surgery may not be recommended for people with epilepsy as it can increase the risk of developing seizures. A recent study published in the Journal of Neurology found that patients with a history of bariatric surgery were at an increased risk of developing epilepsy. Now, the study suggests that epilepsy is a long-term risk associated with bariatric surgery for weight loss. However, each patient's situation is unique, and the decision to undergo surgery should be made in consultation with a qualified healthcare professional. Have we done this in the past? Yes, many times. Your doctor, in this case, your neurologist, can help you determine if weight loss surgery is a safe and appropriate option for you, given your medical history and your current medical or health status. This is what we do. This is what we require. We require the neurologist's clearance on these patients, saying that they are a good fit for weight loss surgery, and then we can proceed and the patients have a great outcome. It is important to know that there are many different types of weight loss surgery, and some may be more appropriate than others depending on your individual needs and medical history. Being the gastric sleeve a very, very safe option, your doctor can help you explore your options and make an informed decision about which type of weight loss surgery, if any, is right for you. Our third question is, can I get like a body treatment or cavitation in this case after surgery, and when is it okay? All right. So cavitation is a non-surgical method of reducing cellulite or localized fat. It involves applying pressure on fat cells and using ultrasonic vibration, which can break down the fat cells into liquid form. Then the body can get rid of it as waste through your urine. However, it is not recommended to undergo cavitation right after abdominal surgery. The goal of cavitation is to blast the fat cells, making them rupture and release their content. This could damage your surgical site and can lead to complications. We recommend you wait at least 6 to 8 weeks after your surgery to let everything heal nicely. It is best to consult with your doctor before undergoing any type of body treatment after your surgery. All right, so there you have it. That is it for episode 227. That was a really good episode, wasn't it? If you liked the episode and the content, if you can leave me one of these, I greatly appreciate it. And don't forget to hit that subscribe button down there. And don't forget to send me your questions. Use the hashtag AskDrA. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.